colleagues and those joining us online. It is a pleasure to welcome you to the Office of the Prime Minister's weekly press briefing, where we have an exciting day planned for you, giving you the information that you need to do the jobs that you do so well. I'm going to call the press secretary now, who's going to introduce our speaker for today.
Good morning, everyone, and welcome to another week. Happy New Year. It's our first press briefing for 2022, and we're expecting a great year. Thank you for those of you who have joined us and those of you who are tuning in online. Happy New Year to you. It's going to be an exciting year for the Davis-Cooper administration. We're expecting to not only succeed in a number of targets that we set out in the Blueprint for Change, but also to ensure that Bahamians experience the goodness that the Blueprint of Change has been designed to offer them. We want to ensure that people have better qualities of life and living. We want to ensure that wrongs are corrected and that people feel good, a sense of goodness again about their government and about living here in the Bahamas. And that's our focus in 2022 as an administration, to make sure people feel good about their government again. We started that in 2021, and we expect to wrap that up and continue that and do even more until Bahamians feel the impact of the Davis and Cooper administration working for them. We want to get right into our press briefing. We're going to try and make this half the time that we normally do, just to make sure that in this season and this time where we have increased cases of COVID, that we don't put anybody at greater risk. And so we're going to try and keep the press conference today to a half an hour instead of a full hour, so that you can get in, get your questions answered, and get out today. There are a couple of things happening in our financial sector, the Ministry of Finance. As you would have known, just a few days ago, 6 days ago, we began the introduction of 10% VAT, and you should have begun seeing the savings as you shop or wherever you went to purchase things. You would have seen that 12% drop to 10% as promised. I'm going to invite our Financial Secretary, Mr. Simon Wilson, to come and talk about the implementation, how things are going, how things have gone, and also to talk about really where we're headed as far as tax reform. So without further ado, Financial Secretary of the Bahamas, Simon Wilson.
Good morning, everybody. It's my pleasure to be here this morning. So I think the press secretary indicated that on January 1st, the VAT rate reduced from 12% to 10%. That was the overall headline there. But there's some other important changes that happened on January 1st with respect to VAT. On January 1st, offshore financial services were moved from exempt, zero-rated, backdated to July 1st, 2019. For the offshore financial services sector, that's a very important change. It meant for them that their tax liability for the government effectively became zero. Many of them were facing significant tax liabilities because of a change that was made in 2019. In addition, domestic zero rating of goods were eliminated. And in the media, that's referred to as applying VAT on bread basket goods. But it's really simplifying the tax system, making it more equitable for everybody, and reducing the burden on the small businesses. As you know, on bread basket items, which comprise for many small businesses, small retail grocery stores, the majority of their sales, those persons could not recover the VAT on the sale of those goods. So many small businesses, small grocery stores, had to carry accounts receivable, VAT receivables from the government, refund receivables for a long period of time. So that change was made, which really benefits small businesses. In addition, the reduction from 12% to 10% covered all goods, including land sales. So overall, the cost or the tax liability for behemoths was reduced on January 1st. In the bigger context, this is part of the government's initiative to bring in equity and fairness to the tax system. There are some other things that will be taking place which will be announced during the mid-year budget in the Prime Minister's communication, as well as the annual budget. The Prime Minister in the supplementary budget indicated that the rate, GDP to tax rate, will increase from the present level to 25%. That can only happen if the system is more fairer and more equitable for everybody. The final thing I want to say about the January 1st date or reduction in VAT, the basic rate, is that based on all the calculations, this reduction is going to be revenue neutral and actually slightly positive in terms of revenue yield. So it's not going to result in an increase of the fiscal deficit. That's a very important point. So this is not a reckless, populist act, rather a measured act to improve the livelihoods of ordinary behemoths. I want to thank you so much, and I'm available for any questions.
You said the reduction will, at the end of the day, result in I don't want to use the wrong term, an increase basically in revenue. Can you put some numbers to that? What the forecast say?
I will be very careful with that in terms of providing numbers for the forecast, but based on the estimates that the Prime Minister presented in the supplementary budget, the reduction is going to be at a minimum neutral and positive. During the annual budget exercise, we'll have 4 months of data, and we will present that in terms of what is the increase overall in terms of the reduction.
Apart from the VAT reduction, are there any other tax reforms you think will be implemented in the short term?
Well, the tax system we have now is a very narrow-based system, all right? And so the tax reforms that we envision is broaden the base and lowering the overall rate for behemoths. Right now, we tax a few at a high level, and the idea is we're going to broaden the base and lower the overall rate. One of the areas that we are looking at closely is property tax in terms of how do we broaden the base and lower the rate so our yield goes up.
The Omicron variant is already having an impact on the tourism sector. There's been a lot of cancellations of reservations and the like. Is this causing you all to take a look at the forecast as far as fiscal deficit projections?
No. So in the supplementary budget, the Prime Minister indicated clearly that the existing revenue forecast that was met in place by the administration will be maintained. That forecast had revenues at a very suppressed level. So the $80 million that the Prime Minister talked about in the supplementary budget for the 3 months in revenue, that was added to the revenue forecast. So since that time, we have gotten additional $80 million over projections, end of December. So we've kept from January to June the same, which is suppressed. We believe, all things being equal, that we will exceed the revenue targets for the next 6 months.
Are there any major budget changes coming up in the mid-year budget now that you've had a chance to get a better idea of the government's finances?
Traditionally, the mid-year budget doesn't do changes. It forecasts what's going to happen in the annual budget. It speaks for performance and indicates what's going to happen in the annual budget. So it's unlikely to see any change, but it will speak to the government's better appreciation of the fiscal conditions of the country. The supplementary budget is made 6 weeks after the change in government. They have now 4 months, the government has 4 months to get more information. So I think the PM in his statement in the supplementary budget, in the mid-year budget, will talk more about the fuller picture and forecast any potential changes based on information he has now.
Do you have an update on the debt advisory committee? Have they met yet, or what avenues are being discussed?
The debt advisory committee has been appointed. part of the Debt Advisory Committee's work is we are seeking to conclude the appointment of a debt advisor, an independent firm, who will advise the committee and the government on overall debt strategy. So the committee is a functional committee, it's not just a talk shop, so we want to make sure all the pieces are in place. And one of the key pieces that we felt was very important for the Debt Advisory Committee was have a specialized firm to advise the committee and the government in terms of how we manage this, the debt situation that we're in.
Currently, where the country stands I guess, from an economic standpoint, would you say the government is satisfied where we are despite what's going on?
I will say let me speak from the Ministry of Finance perspective, all right? So I think we are very satisfied. If you look at our revenue performance against forecasts, we are $160 million above revenue performance. The Revenue Enhancement Committee is actually a unit, is actually being formed and is working. We've engaged our revenue advisors. We are very excited what we see in terms of the potential for revenue yield. On the expenditure side, the overhang in terms of liabilities and so forth has been reduced. It is not reduced to a bare minimum, but it's reduced considerably from when I came back into the office. So from that perspective, I think I see green shoots in terms of the strategy.
What's your perspective on how officials in the service have, or the kinds of challenges that they've encountered complying with the Public Procurement Act?
The Public Procurement Act was an act, let me give you a little bit of background so you can understand where I speak. The Public Procurement Act was drafted over 10 years ago. Okay? It's a very complex piece of legislation. So governments had moved very slow to implement it because of the complexity of the Public Procurement Act. I was a young economist when the act was drafted. All right, the act was put in place with the absence of the things that make it work: the manuals, the training, the regulations. You know, it's not a very easy act, and it's a non-trivial piece of legislation. The government's position is that the act needs to be revised, the regulations need to be put in place to make it functional. The framework is excellent, but when you start looking at the actual clauses in the act, you realize that it's impractical. So let me give you an example. Any procurement under the Public Procurement Act has to be out for 30 days. So imagine this. You want to buy the disinfectant spray, which is a homogeneous good, Lysol. All right? Everybody know what Lysol is and so forth. You get 3 quotes. You have to hold those quotes for 30 days before you can actually make the purchase. That's a very impractical approach to doing anything. Then, in addition, the act, part of the act is this online portal. The online portal was purchased by the government about 12 years ago. Right? It's old, it's cumbersome, it's very frustrating, it doesn't do the segregation. So you have merchants who complain that, you know, I'm interested in projects over $1 million, I get these hits, I'm checking the hits, and it's for 3 tires. It's a waste of my time. And people feel disconnected from governance because they say, hey, I'm not getting the real information because the portal itself is ineffective. So in procurement, we have some changes planned. Legislation is going to be upgraded and modernized to some extent. The portal is going to be upgraded and modernized.
Presumably contracts are still being issued, so what's the difficulty complying with that provision of the Act?
Which provision?
The reporting requirement that you issue publicly a statement with a list of the contracts that have been awarded and the like.
You read the act?
Yes, I did.
Okay, so what provision has not been complied with?
The reporting provision.
Which report? Who should report?
The government should report
Which-
on which contracts. that
Who
they-
officer in the government?
Well, you're
Read
the
it.
financial secretary.
No. You asked the question, so I'm asking you, did you read the act? The act speaks to an officer reporting. Has the officer been appointed? Was the officer appointed on September 1st? Has that position been created in the public service? That's the challenge that we have with the act. So the act speaks to a chief procurement officer. If you look at our salary book, there is no chief procurement officer. If you understand the public service, how it operates, we have to create a post. We have to go to the Public Service Commission. We have to put it in a salary scale. These things can't happen overnight. See, that's the challenge. You could put all these fancy provisions in, and you could give people these responsibilities, but if it didn't say the financial secretary should report, it said the chief procurement officer. I am not the chief procurement officer, so I can't report. I need, if I want to be true to legislation, it should be the chief procurement officer. This is one of the amendments we want to make, because really, when you put in legislation to create a framework, you have to make sure all other things are done properly. If you create a post, and in the act, the powers in the act, the reporting powers are in the chief procurement officer. We have no chief procurement officer. On September 1st, there was no chief procurement officer. The process of creating a post is not a straightforward post. You just can't give somebody a name and say, oh, Simon, you are chief, whatever. You have to go to the commission, which is an independent body. These are the things that create the difficulty with the act. That's the reality, and that's why it's important to read the act and understand it, and not just not think that the government is not trying to do it. Governments love to tell people, I sign a contract. They have press conferences all the time to say, I signed a contract, I award a contract to John Doe to build a school.
Do you have a figure for how much was spent during the state of emergency?
No. The challenge that we have is that the information that is available with respect to the state of emergency is not easily available. So it's a real challenge. So if you ask me about anything in the state of emergency, any expenditure, I have no information. If you ask the persons who were involved, they have no information. It has to be gathered and collated to be presented.
So are you gathering that information?
We have started an exercise to look at, for example, the food program. Unfortunately, the information is not readily available. So we're working on that.
Can you say to what extent the National Insurance Board has begun to recover after making so many benefit payments during the course of COVID-19, and what the forecast may be for recovery? How many more benefits are beginning to be paid again into the board since people are going back to work?
I cannot. You have to ask National Insurance that question.
Now, we know that on medication was a sore spot for many. Has there been any definitive decision on that on medication?
The largest purchaser of medication in the country is the government of the Bahamas, by far. I think the government purchased maybe about 70% of the medication, 80% of the medication. The remainder is purchased through insurance companies and so forth. So the benefit of zero-rating medication actually fell to the suppliers of medication and not to the consumers. Most medication in countries are actually distributed free or at significantly discounted amounts. So I really don't understand the context of that. Because if you look at the price levels, you'll see that there was, with zero rating of medication, there was no drop in the price or the inflation levels with respect to medication. So those savings went elsewhere. They didn't go to the consumer.
Could you speak to any opportunities that the Revenue Enhancement Unit has identified to increase national income?
Or revenue? Many, actually. I don't want to bore with the technicalities, but certainly one of the easy ones on the ground is this issue of non-compliance or non-filing by VAT registrants, where VAT registrants simply miss a quarter or miss a month and then continue onwards, or have filed and say, I owe you $20,000, but they don't actually pay the $20,000, they continue onwards. All right, so those are easy ones right there. And there's some other ones which involve using data more aggressively. One of the more interesting ones that we uncovered was, if you look at your electricity bill throughout the Bahamas, you discover you have more persons on BPL's roll than we have land registered. So if you think of this, say, for every house there should be an electricity connection. All right, you have more electricity connections than you have houses in your property tax system.
What about real property tax collection, is that improving?
We have a strategy for real property tax collection that we will unveil during the mid-year budget to improve it.
When will the mid-year budget take place?
Mid-year budget just will take place in February.
Okay. Thank
All
you,
right,
Ms. Wilson.
thank you.
Appreciate it.
Thanks.
Thank you. Hopefully that gives you a clearer picture and understanding of where we're at and what's to come. We got about 10 minutes left because we want to get you out here early. I'm going to give you some updates from Prime Minister, and then also we want to let you know that next week there will be another update on COVID-19. The press conference will be joint with Ministry of Health, so they will provide another update on COVID-19 after the holiday next week. We're also going to be, for about 2 weeks, moving the OPM press conference to Zoom online, so that we don't have to be in person for the next 2 weeks. So that will begin next week as well, just to enjoy safety. So we won't be able to feed you for 2 weeks, unfortunately. I know that's going to be very hard for some people to understand. All right, let's give you some announcements and then get you out of here. Free testing pilot program in New Providence. I want to talk to you about that. The government of the Bahamas will roll out its free testing pilot program in New Providence beginning on Saturday coming. Residents must register at covidtest.gov.bs beginning tomorrow. You can log on and begin registering for your free testing here in New Providence to be tested at our sites. Now, we're going to begin on Saturday with Kendall Isaacs Gymnasium and Malia. And of course, Kendall Isaacs Gym will be in the form of a drive-through where you drive up, you take your test, and you're on your way. And of course, Malia. So those of you who want to participate in testing, we encourage you to be able to do that. Now, that's for persons who are asymptomatic. You're not experiencing any conditions, whatever. You go to those particular facilities for your free testing. Now, for those of you who are having symptoms, you're going to do testing at the South Beach Clinic, which will reopen this week as well. All right, South Beach Clinic will be up and running again, and that site does not require prior registration as the other sites do. The rollout of this program, of course, begins on Saturday. It's a progress toward our goal. We've been talking about a free mass testing nationwide. As you know, we rolled out a pilot program last year on the Fahmy Islands. That went extremely well. We were able to make adjustments based on what we saw there. We're going to roll it out here in New Providence beginning this weekend, and so that we can tweak and make any adjustments that need to happen before it becomes a mass rollout nationwide. This is the first time of this magnitude, and this is why we're very excited about this. It's being undertaken since the start of the pandemic. There's been no free testing program in the country, and so the Davis Cooper administration is extremely happy to deliver on this promise and to show leadership up front. We believe it is a vital step in fighting the virus. The testing at all sites will be rapid antigen tests, and should the test come back positive, a PCR test can be done, particularly at the South Beach Clinic. So we expect that to begin. All of the framework has been put in place, the platforms have been put in place, and like I said, you can begin logging on tomorrow to get your time for your free testing, and we expect this to be a significant tool in helping us to fight the COVID-19 virus. I also want to give you an update on our hospital's readiness in this fight of COVID-19. We've opened 4 tents at the Princess Margaret Hospital. We are building capacity not only in infrastructure, but also manpower. We've asked the Department of Public Health to lend us nurses to ease the burden felt because of those medical professionals in quarantine. We've had success with that as well. We've also reached out to 12 Bahamian doctors who will be engaged to support the staff at the Princess Margaret Hospital. And 50 nurses are expected from Cuba by next week to assist in the fight. So we are building capacity, particularly where it's so important with our medical professionals. Many of them are in quarantine, are not able to work. We are building capacity to add personnel. As you can imagine, you can expand the facilities and have more wards and tents open, but if you have nobody to man those, you can't use them. So we're happy that we're building capacity and finding resources to be able to operate these particular facilities so that we don't have a situation where we have people and no beds for them to go in or nobody to attend to them. That is happening right now. The Ministry of Health is leading out front and ensuring that takes place. Futuristically, there are partnerships that are being discussed in discussions now. Prime Minister and some of his advisors held a call earlier this week to talk about new healthcare facilities that are needed and upgrades. The government of the Bahamas is now in negotiations with private partners to help build capacity at our healthcare institutions across the Bahamas. And of course, we'll give you further details on that, but we can expect better management, operation, and revenue from our institutions in the near future, as well as additional institutions. All of those are in discussions now. And of course, you may have heard, but we've been in negotiation with the nurses union over the past few days about the lump sum paid owed to them. We're happy to report they will be paid this week. Some of them have already gotten money in their accounts. Others will be getting it this week. Nurses will get that lump sum. And that, no doubt, is an added incentive for them to be on the front line during this heightened period for the nurses. So we're happy for that. Dr. Darvell said he and Prime Minister will be meeting with Doctors Union next week to be able to address their concerns and their remuneration packages to get money to them. And of course, you would have witnessed or been able to see footage of a signing for a medical school, heads of agreement. Government of the Bahamas signed an amended heads of agreement with the Western Atlantic University School of Medicine yesterday. This new heads of agreement of medicine, profitable structure for the Bahamas, that removes a moratorium that was on medical schools. That has now been removed. This opens the Bahamas to more educational investments. The devastation of Hurricane Dorian in Grand Bahama did not sway the particular group commitment to the island. CEO Peter Gotez of that group said that they were committed to being a part of the renaissance of Grand Bahama. Prime Minister Davis said he's excited to see the economic growth of Grand Bahama, as he knows that college towns help to spur growth within the community. So we're excited on that front. And then we do have some new appointments to give you as well in the government service. Today, the Office of the Prime Minister and the Ministry of the Environment and Natural Resources announced 2 key appointments to support the government's commitment to promoting and supporting issues relating to our New Day agenda concerning environment and climate change. Effective Monday past, Dr. Rihanna Neely was appointed as Acting Director of Environmental Planning and Protection. Dr. Neely holds a doctorate in environmental policy and risk management from Florida A&M University. She's been working in the ministry since 2013 on a range of issues, including climate change, renewable energy, and the abolition of single-use plastics. You might remember that whole campaign of single-use plastics. She was the lead on that. Dr. Neely succeeds Mrs. Rochelle Newbold, who will now be joining the team here, we're so excited about that, at the Office of the Prime Minister to serve as Special Advisor on Climate Change change and environmental matters. You can imagine, having led the technical team at COP26, Mrs. Newbold is well placed to advise on the implementation of the government's multi-agency priorities, from carbon credits, you heard us talk about that, to our new international commitments around climate change. Prime Minister is being seen worldwide as the lead on climate change, particularly from the Caribbean. And so we're shoring up our role in this capacity by ensuring we have the experts and the expertise right here in the office to advise us on the way forward. Prime Minister Davis said in his blueprint for change that our administration signaled the importance and priorities we place on issues relating to the environment and climate change. And you can see we're doing that by making sure we have the right people in place. The enhanced profile of the Bahamas since COP26 and the new partnerships which we have forged since then has given new impetus to these issues. By appointing an advisor in the office of the Prime Minister who is able to work across all government ministries and departments, we will be able to ensure that the government's mandate can be successfully implemented. And so we wish both women well in their new portfolios, and congratulations as we seek to take this further. Colleagues, those are all of the announcements that we have from Prime Minister Davis for you. We are at 11:31. If you have a burning question that wasn't answered and that cannot wait till next week, I will take it now. Other than that, we want to introduce our small business reception to you. Any questions before we go to that? Yes, Kyle?
Yes. I just want to know, can you confirm that one of Prime Minister Davis's children, one of his daughters in particular, was appointed to a government board, the NSA in particular? And if so, do you think this could be perceived as a conflict of interest?
I'm not aware. I can find out for you. I'm not aware of that happening. This is the first time I'm hearing it from you. I'll check it in for you and let you know. But by and large, Prime Minister's policy is not for relatives to serve under the particular minister. Because we're a small nation, people are related everywhere, but not if it's under the ministry of someone that you're related to. But I'll check into that and find out for you.
So if in fact it is her, it wouldn't be conflict of interest according to you?
It would be, and until you, Prime Minister Davis Board would be the first one, if it's under his portfolio, to make a change in that, if it's under his portfolio.
That's the NSA.
I'll check for you and find out. Anybody else? So somebody else.
How often can you get a free COVID test?
Jasper, once you sign up for that test, it will flag you in the system, because what we don't want is for people to be going back every day. You can do it once per week, though, that is. All right, once per week. We don't want people to be every day, using it to be able to go to have dinner somewhere and just get a free COVID test so you can have it with you. It's for people who want to make sure that they're not positive or they've been exposed and so forth. So it will flag you and only allow you to do it once per week.
PCR and rapid.
It's antigen. PCR can be done at the South Beach Clinic for persons who are experiencing symptoms, and if the antigen test is inconclusive, they will perform a PCR test at the South Beach Clinic. But the sites will be performing antigen tests.
Are the nurses from Cuba committed to one area, a set of responsibilities, or will they be dispersed where needed throughout the system?
The main focus will be the frontline fight with COVID-19, but obviously they will be working with the hospital. The hospital administration will determine where they need capacity. There may be some on wards. If, for example, if on a ward a nurse has been exposed and is in quarantine, they may need to place a nurse there. So they will see where the needs are and assign them throughout the hospital and the healthcare sector.
Mr. Watson, we're at the point where we're confirming hundreds of cases daily. If you mentioned that if the rapid antigen comes back positive on Saturday or going forward, they would go to South Beach Clinic. But do you really think the clinic has the capacity for all of those people to go there?
And that's not the idea of it. Remember now, if you go to one of the drive-up clinics or one of the drive-in testing sites and you're positive, then you're positive. It's up to you to decide, okay, well, I'm not sure or I'm not going to believe this, but if you're positive, then you would hopefully do the next best thing, which is to isolate and quarantine. Particularly, remember, these are asymptomatic people. So the idea is if you get a positive test, that you go and do what is the next step for you to do, as would have happened if you would have gotten an alert from a testing lab that you would have gone to. What's happening is for persons who are symptomatic, we don't want them mixing with people at these sites. So we're saying if you're experiencing COVID-like symptoms and conditions, go to the South Beach Clinic. If a test comes back negative and you're still experiencing conditions, they may opt to do a PCR test to make it more conclusive.
To Back off of Kyle's question, how many persons, I guess, the sites are being prepared for Saturday?
We're looking into doing 400 tests in total per day.
Okay, and another question, has there been any pushbacks, I guess, from the private labs in terms, because for the most part, persons have been paying for tests, has there been any pushback from the private sector?
No, and I don't think there should be. This is not about making money. This is about being able to contain a pandemic in our country and ensure people get the services. And I believe above all, in any of these labs, the focus should be providing a service to people. And don't forget, a lot of these labs over the period of time will be working with us to do these tests. So they will have people on these sites. So it's not like they're going to be undercut. But I think it'll be a good thing for the Bahamian people because if people can now get free tests, maybe a lot of these labs will reconsider what they're charging for their tests.
So that's 400 tests per site, right?
There'll be 400 tests per day. 2 sites were operating. One of them I think will do maybe up to 300, another one up to 100, but 400 between 2 sites.
And how much is this costing the government?
We're putting together the figures. We have been able, Dr. Arville has said they were able to procure us funding that was already allocated for COVID-19 through a funding. And so they're using that. So that's why you see us have this cap, Jasper, of 400, is to make sure we stay within the budgeted amount that we have to be able to do this. And so that's why we're capping it at that, to be able to ensure that we do not go over budget. And if the need arises that we have to do more, they will go back to the drawing board and discuss how best we go about that.
That's what probably that 400 is per day.
Per day.
Per day.
Correct. Per day.
Does health officials feel like that as an adequate number of testing to do enough
We
testing?
won't know until we see it in effect. That's why when we start on Saturday, it's a pilot program, so we can see what kind of capacity we're building for this. So after Saturday, we'll have kind of an idea based on who's registering, whether this is good, whether we have to reassess. We won't know until we put it in place.
Some of the emerging data seem to indicate that the antigen test is particularly less sensitive at capturing the Omicron variant. Is there any concern that people could get a false sense of comfort if they take the antigen test and it's negative?
There's always that concern, particularly with COVID-19. There's always that concern. However, we believe if we start here, we're able to bring relief to a problem that's been mushrooming. And so we're happy that we can start at this point to be able to ensure the Bahamians have some resolve. Sadly, in this country, a lot of people aren't testing and haven't tested for the past year and a half of this pandemic because they simply can't afford it. We want to provide an avenue where people do not have to say, I didn't test because I couldn't pay for a test. So this is a first start for us. It's revolutionary. We understand that for the Bahamian people because the previous administration did not do this. This is a big step that we're taking, but we believe it's worth the investment to our Bahamian people. That's why we're testing as a pilot program, and we see how things will happen. This is just one measure. One measure, and I want to stress that. This is just one measure that we're putting in place to address and deal with the COVID-19 pandemic. We have already put a number of other measures in place. We've cracked down on a number of measures. We've cracked down on the 5-day test to come into the country to 3 days. We've moved, as you can see, the implementation of the PCR test so that the people who are traveling have enough time to be able to get it because of the surge happening in America, but we're putting that in place as well. We're also ensuring that persons who are positive, particularly in government agencies, do not come to work and they can work from home or work remotely until they recover. There are a number of things that we are putting in place to be able to ensure that we are fighting this head on. We're not sitting back and doing nothing. I know there are some out there who have suggested that the government needs to lead. Well, what do you call this? This is actually bold and revolutionary leadership, and it's taking the stance from out front. I just wanted to give you a couple of things for those who may not be sure. Aside from encouraging vaccinations, which we've been doing, and we're seeing an uptick. If you visit the vaccination spots, you will see lines. People are going in and getting vaccinated. People are going in and getting their booster. We are continuing to encourage vaccination because we believe it is a critical tool. One of the biggest and best tools, though, in this particular surge with this particular strain, though, is medical grade masks. We're not just telling Bahamians that you need to get a medical grade mask because we recognize it's expensive. We are providing it free for Bahamians. We have started mass distribution of medical grade masks so that Bahamians can go to locations, get them free to protect themselves. We are putting that in, that's already in place and it's already happening and people are already accessing the free mask. The third thing we're also doing is the free testing, which, as we've told you, we're rolling out. Ensuring people now have access to tests and don't have to worry about whether or not they can afford or pay for the tests. We're also increasing bed space and the capacity of people to operate and to work in these hospitals to ensure that we have people to man these particular tents and the particular beds. That hadn't happened before. We're doing it now, bringing in new nurses so that people can assist, ensuring those who work now have been given their pay and back pay so that they're able to do their job and feel some sense that they're being compensated for it. We've worked with the churches to ensure that they tightened on their restrictions and moved the count from 30% of capacity to now 25%, and working with them to ensure that they keep services to a minimum and that they practice the protocols without having to legislate them, but allow the Christian Council to work with churches. We've been doing that. We are ensuring that at the end of the day, the economy continues to operate. People continue to get their full salaries. Many of them have just now started getting those salaries again. But while we're doing that, we're putting in place measures and protections for our people. That is leading from out front. And no one can deny that because you can see that happening in the country. And so while the cases are rising, as they are pretty much everywhere around the world because of the strain, we are putting measures in place that Bahamians can protect themselves. And we are comfortable that we are achieving what needs to be achieved, and will continue to fight to ensure Bahamians are protected. That's not political, that's factual.
PCR question. You said that PCR tests will be free and available for anyone who's symptomatic. Is that not already the case?
It is already the case. It is already the case. But remember, the South Beach Clinic was under renovations. So we've reopened it to ensure that people can still have access to it. Because remember, government had always provided it, but there was a backup at labs. We are providing support. And one of the things you will see Dr. Darville and his team do is when they see there is a clogging or a blockage, they look quickly for a solution. And that may mean bringing on board more private sector companies to perhaps test these results rather than having to depend on the one clinic, on the one database to be tested. We're looking at avenues, Jasper, to ensure that we find new ways to be able to ensure the Bahamians have access to what they need to get through this pandemic.
Are you seeking to bring these numbers down, or are you just managing them?
Sorry?
Are you seeking to bring these numbers down, or are you just managing it?
We're seeking to do both, but it's not something that we have control over. No country has control over the Omicron strain or cases going up. What you can do is put in place measures to safeguard your people, to protect your people, and to ensure they have access to what they need to get through the pandemic. And that's what we're doing for the Bahamian people.
So why not just send a stronger message?
We've been doing that. We've not sent any weak message. We've told Bahamians that we need, first of all, personal responsibility. Right? Personal responsibility, because at the end of the day, no matter what we put in place, if you don't wear your mask or wear medical grade masks, or you don't stop having large gatherings and you're not following the protocols, you're putting yourself at a greater risk. And the reality is, though, that even when you follow those, doesn't mean that you'll be immune to not getting it. Doesn't mean that everyone who's caught COVID-19 didn't follow protocols. It is just that, a pandemic. But what you do is you put in place the best measures to safeguard your people as we move through the pandemic. And that's what we're trying to do.
Is there a particular firm that's supplying the tests? Did that process go out to?
No, we're working with local Bahamian companies regarding this. We've asked companies who can work with us, they're willing to work with us, and what we can work with them with as far as costing. And that's how we began this program. We're going to extend it. We're going to include more people. But this is just to see whether this capacity that we have actually work. And Dr. Darville in his health address next week will give you more specifics on that, the numbers, the companies, how they were achieved, and so forth. He'll give you all of that in the update next week. Once they would have been able to look through the data as well, he'll have all of that for you in the health presser next week.
So it's only this weekend, it stops after this weekend?
No, it continues. No, it continues. No, it's every day.
Okay.
Every
So
day.
there's no end time for this? This isn't a pilot, this is
No,
a rollout?
this is a pilot, but a pilot also means that you're assessing how it works and may need to tweak it, but doesn't mean it will stop. Okay? Thank you all for being a part of the press. I want to introduce our businesses today. We have two companies. Shrimp Shack is here. I want to invite Mr. Anthony Seymour to come and talk about Shrimp Shack. Anthony, sorry. Come on and talk to us about Shrimp Shack. And then we have Chef Emily, who's a private chef. She'll come and tell you about what she's talking about today. Come for me, please, Anthony.
Good afternoon, everyone. My name is Antonique Seymour, owner of Shrimp Shack, along with my father, mother, and brother. Shrimp Shack is a family business. Although our name is Shrimp Shack, we do not only sell shrimp. We sell salmon, mai, lobster, rack of lamb, and calamari, just to name a few. These are served with fettuccine, fries, or salad. We have the best fettuccine in Nassau, but we also have your typical conch snacks, and we have a unique burger that we top with onion rings. Shrimp Shack is basically an Italian restaurant with a bohemian twist. As of right now, we only have one location, which is in Fox Hill. If you're coming from Prince Charles heading north, we are on the left after you pass Fate Mission. If you're coming from the roundabout after you pass the park, we're on the right under the cotton tree. And lastly, I'd just like to say a special thank you to our friends and family that support us. You are not our customers, you are our family.
Tell us what you're sharing with us today.
Oh, today we have a little bit of everything. We have the onion rings that we put on the burger. We have salmon. We have a special lemonade that we made. It's ginger. We have our signature biscuits. People really like them. I think we have our fettuccine, and you could get it spicy, mild, and no spice. We're cooking it as you guys get there. And I think that's it.
Thank you. Thank you. I already see Kyle and Rashad trying to make their way there now. Okay, let's meet. Let's go ahead and meet Chef Emily, who's a private chef. Welcome, Chef Emily, and tell us about your business and what we have today.
Good day. My name is Emily Darville, and I'm a private chef. And as such, my services include event catering and cooking on board yachts. So I'm also a yacht chef as well. I've been in the industry for the past 10 years, and I specialize in both cuisine and pastry. Today I've prepared an assortment of glass desserts for you to try. I have a spiced carrot cake with cream cheese frosting and candied walnuts. I have a decadent chocolate cake with chocolate mousse and chocolate ganache, and also a citrus cheesecake that will be topped with mixed berries and a vanilla chantilly. I can be reached by telephone. That will be 808-4686, or on Instagram. My name is Chef Emily 242 on Instagram. Thank you.
Thank you, Emily. All right. Did we do good for our first presser with our? Y'all are something else. So don't forget, next week and the week after next, you will be online. So we will taste by clicking on the right button next week. Thank you so much, colleagues. Let's look forward to a great year, and all of you joining us online. Have a great day.